ሰላም እንደምናላችሁ ድጋሜ በሌላ ቪዲዮ ተመልሻለሁ። ኢንትሮዳክሽን ሴክሽን ላይ እንደተናገርኩት በዚህ ቻናል some of them ፕሮፌሽን ስፔሲፊክ እንደሚሆን አውርቼ ነበር። አንደኛው ስፔሲፊክ ፕሮፌሽን አድሬስ የሚያደርገው የፋርማኮሎጂ ሌክቸሮች ናቸው። እሱን ደግሞ አብረን የምንላቸው ይሆናል። so pharmacology for years 2 midwifery students የሚለው ያው የኔ ያስተማርኩበት ስላይድ ስለሆነ ከዛ የተወሰደ ነው። ግን however the concepts እዚህ ጋር የተጻፉት ነገሮች can be applied for other healthcare professionals also ስሜ አልፋለም ይባላል። ያው as always there is a question general knowledge ለማውራት just ማንበብ ብቻ ይጠይቃል። ግን ፕሮፌሽን ስፔሲፊክ ሲሆን ግን ስለዛ ስፔሲፊክ ፕሮፌሽን ምን ያህል ኤክስፖዠር አለው ኤክስፒሪየንስ ወይ ደግሞ ኖሌጅ አለው ብሎ መጠየቅ ተገቢ ነው። so am I the right person to teach pharmacology የሚለውን አድሬስ ለማድረግ እንግዲህ ባችለር ኢን ፋርማሲ ማስተርሴን ደግሞ በፋርማኮሎጂ ሰርቻለሁ ላለፉት 6 ዓመታት ስኩል ኦፍ ፋርማሲ አዲስ አበባ ዩኒቨርሲቲ ፋርማኮሎጂን በማስተማር እንዲሁም ላብ አክቲቪቲዎች ላይ አክቲቭሊ ኢንጌጅ በማድረግ ሰርቭ አድርጌያለሁ። so I think that's enough and coming to the section this is a class so ብዙ ቻፕተሮች ይኖሩታል። ያሰብኩት ይሄን ሌክቸር የመስጠት ሀሳቡን ሳስብ ምንድነው ያሰብኩት በየሌክቸሮቹ ሜቢ ከ10 እስከ 15 ወይ 15 እስከ 20 ደቂቃ በሚሆኑት በእነዚህ ሌክቸሮች ውስጥ ለመስጠት ያሰብኩበት ሎጂክ እንዴት ነው ከስላይዶቹ በኋላ ኢንትሪጊንግ የሚሆኑ ኩዌስችኖችን ዲዛይን አድርጌ እነሱን ደግሞ ድጋሜ አብረን የምንሰራበት ሴክሽን ይኖራል። ስለዚህ ዛሬ ለምሳሌ 10 ስላይድ ወይ 15 ስላይድ አብረን የምናይ ከሆነ እሱን ስላይድ ደግሞ በሌላ ቪዲዮ ላይ ከዛ በወጡ ጥያቄዎች አብረን ዲስከስ የምናደርግበት ይሆናል ማለት ነው። so today we're going to see about the basic concepts of pharmacology and as a learning objective these are the learning objectives. and so the basics of pharmacology ሲወስድ ወይም ደግሞ general pharmacology ሲወስድ at least እነዚህን learning objectives achieve ማድረግ አለበት at the end of or on the completion of this chapter. so pharmacology define ማድረግ መቻል is one of the objective. There is pharmacokinetics in define ማድረግ, pharmacodynamics in define ማድረግ, toxicology and other also there are basic terminologies usually clinically ወይም ደግሞ health related የሆኑ ሳይንሶችን ስንማርም ስንሰራም የምንጠቀማቸው basic terminologies አሉ። እነዚህን terminologies we will define them. Next to that there are different names which are assigned for a drug. እነዚህ ስሞች ማን ናቸው ምንድን ናቸው የሚለውን አብረን የምናይ ይሆናል። and also would have different class of drugs ወይም ደግሞ based on their whether they are controlled or not, whether they are prescription drugs and prescription drug or they're psychotropic and narcotropic drugs ናቸው የሚለውን የምናይባቸው ሴክሽኖች ይኖራሉ። the other one is we will discuss the various types of drug reaction produced in the body. so and drug act ካደረገ በኋላ የሚያመጣቸው የተለያዩ desirable የሚሆኑ undesirable reactions አሉ when they interact with the biological system. so we will try to see which reactions are due to a drug or whether they are desirable or undesirable. Next to that we're going to see about the factors that can influence drug action እንዴት affect ያደርጉታል የሚለውን ሐሳብ we'll see in this section. As you know, there are different factors ከድራጉ ፊዚካል ኬሚካል ካራክተሪስቲክስ ሊሆን ይችላል፣ ዲዚዝ ስቴት ሊሆን ይችላል፣ የሆስት ፋክተር ሊሆን ይችላል or other environmental factors ሊሆን ይችላሉ። There are drugs, እነዚህ ድራጎች due to different factors affected ሊሆኑ ይችላሉ, and their drug action can be diminished or enhanced. And we will also see different types of drug interactions that may be seen with drug administration. As you know, clinically, and so rare now. Single case አጋጥሞት ሆስፒታል ውስጥ አድሚትድ የሚሆንበት ሴናሪዎች በጣም ሬር ናቸው እና አንድ ሰው 76 በሽታዎች ሊኖሩበት ይችላል ወይም ኢምባላንሶች ሊኖሩበት ይችላል። so along with the major finding ወይም ደግሞ ዋና አድሚትድ የሆነበት ኬዝ ቢኖርም along with it there are other concomitant ወይም ደግሞ comorbidities እንደሚኖሩ ይታወቃል። so when you administer different drugs for to treat different disease conditions, there might be drug interaction. So we will see the types of drug interaction in this specific learning objective. The other one is, after all, the pharmacology should be applied to the specific discipline, healthcare discipline. So in this scenario, we will try to see the midwifery implication. However, we will also cover other aspects related with its clinical implication. So coming to the outline, these are the outline, and my presentation is divided into four sections. One is the introduction section. The next part is the drug-body interactions. The third one is adverse drug reactions and interactions. Finally, we will see the application of pharmacology in midwifery practice, and the rest slide ከዚህም በኋላ የምታዩቸው will be classified based on this outline. Coming to the introduction section, መጀመሪያ ላይ እንዳልነው we have to define and basic term giant የሆኑ ግን really እነዚህ ነገሮች ምንድን ናቸው የሚለው ማወቅ ያስፈልጋልና እነሱን ሳያውቁ ዲቴይል ስለ ፋርማኮሎጂ ማንበብ ማጥናት ብዙም ሬሌቫንስ ላይኖረው ይችላል። so the first term that we have to see is pharmacology. Pharmacology, as you know, Greek or Latin words is በጣም integrated with medical schools ያሉ terminologies ወይም clinical application ያላቸው ኬዞች ላይ በጣም Latin terms that are involved, and pharmacology is not a different word also, and it is derived from two Greek words, አንደኛው pharmakon ከሚል term when word derived የተደረገ ሲሆን, and the other is, which is mostly common for others too, logos ከሚል term ነው, which is the study of drug or medicine እንደማለት ነው in general. This is a general annotation, and we have to see the details to understand what pharmacology is. But for a beginner, we have to define what pharmacology is. Now, pharmacology, blend of two Greek words, pharmakon and logos, ማለት እንችላለን. So, ይህ pharmacology ምን ያጠናል? It studies the substance interaction because without a chemical interaction, the pharmacology irrelevant. So, it studies substance interaction with a living biological system. Animal ሊሆን ይችላል, it can be human. Again, it should be a living biological system. And this interaction with the living biological system is usually through the chemical processes. So chemically, this living biological system and the drug will interact or will form a bond, usually a covalent bond, right? But there are other also. And this chemical reaction or process will cause an alteration in the biological function or response. So there is a drug action, and this drug action is implemented on the living biological system. And upon this implementation, there is a chemical process which causes cascades of chemical reactions, and this will result or causes an alteration in the biological function or on the body response to that specific drug action. So most of the time, because we're talking about the clinical application or the clinical aspect of pharmacology. Drugs are the most common, or medications are the pertinent substances in our case. And these chemicals are administered for a patient, specifically clinic setup ላይ በእኛ ለፔሸንቶች administer ይደረጋል. So the idea of administering this drug is not to toxicate or to cause a harm to that specific individual, right? So the point is to have a beneficial therapeutic effect. ስለዚህ አንድ ሰው መድኃኒት ወስዶ ካለበት pathophysiology condition improve ማድረግ ካልቻለ ያን therapeutic effect ማለት አንችልም። ስለዚህ pharmacology ላይ those drugs which are going to be administered for a specific patient should give or help us to achieve a beneficial therapeutic effect ወይም ደግሞ ለትሪትመንት መጥቀም መቻል አለባቸው ማለት ነው። The other term is toxicology. Usually እንደ ኩያማማቾች pharmacology, toxicology ሲባል ይሰማል. And however, toxicology is a branch of pharmacology which deals or which focuses on the undesirable effect of this specific chemicals or drugs when it interacts with the living biological system. So it can be single cell or the whole complex human body or the whole complex environmental ecosystem. And toxicology is more lean to the investigational analysis. So clinically, unless medical issue ከሌለ በስተቀር toxicology እንደ patientችን treatment purpose አስበን አንጠቀም. So we are focusing on the undesirable effect or the toxic effect of a specific drug, or a specific chemical substance. So the toxicology, that's why most of the time clinical application unless medical case ካልሆነ በስተቀር ማለት ነው። The other terminology is xenobiotic. It is derived from the term xenos, which means stranger ወይም ደግሞ የሆነ something foreign የሆነ እንግዳ የሆነ ነገር እንደማለት ነው። So እንግዳ የሚሆነው ለቦዲ ሲስተማችን ነው። So this living biological system, when exposed to these foreign substances, the body considered them as xenos ወይም ደግሞ እንደ xenobiotic agents ነው consider የሚያደርጋቸው። So whatever it is ወደ ሰውነት ውስጥ የሚገባ በሰውነታችን ውስጥ ፕሮዲስ ማይደረግ ነገር ከሆነ ወይም ደግሞ ኤክስትራ ምንጨምራቸው ነገሮች ከሆነ we can consider them as xenobiotic. ስለዚህ drugs ወይም ደግሞ medications that are xenobiotic by nature. ስለዚህ any substance which is foreign to the human body is considered as a xenobiotic. The other one is prodrug. Prodrug ስንል usually pro ስንል በሶፍትዌር በምናምን ከሆነ ወይም ደግሞ ይሄ በሰብስክሪፕሽን የምናገኛቸው ነገሮች ከሆነ ፕሪሚየም እንደማለት ነው። ሜቢ ደግሞ something activism ነገር ከሆነ ወይ ሌላ ነገር ከሆነ ፕሮ ስንል ሰፖርት ማድረግ ነው። I'm pro ካላችሁ ሰፖርት ማድረግ ነው። But in pharmacology, prodrug ካልን it's an indicative term that shows that the drug is inactive እንደማለት ነው። So we say a drug is prodrug if it is inactive and if it needs or requires a metabolic activation in the living biological system. ስለዚህ ሰውነት ውስጥ ገብቶ metabolic activation የሚፈልግ drug is considered as a prodrug. ስለዚህ would have a prodrug, then there is a metabolic activation, then would have an active drug. ስለዚህ inactive form, metabolic activation, then we will have the active form. So in vivo ሲለቀቅ ይሄ drug ወይም ደግሞ ሰውነት ውስጥ living thing ሲለቀቅ the active form can exert that expected pharmacological effect ወይም ደግሞ therapeutic effect ኢፌክቱን ሪሊዝ ማድረግ but without this metabolic activation, the scaffolding on the top of the active drug will prevent or hinder the drug action and finally reducing the drug response or the body response to that specific drug action. Let's see, this drug are inactive form of a drug. All right. This is the most commonly used terminology in pharmacology, and you will hear it again and again in the future. በስራችሁ የሚሆን ኢንካውንተር እናደርገዋለን receptor because when you talk about a drug usually እንዳልነው chemical process ነው, so interaction አለ, this interaction with the receptor. ስለዚህ these receptors are they are component of a cell or in general an organism which interacts with the drug. Let's say there is a xenobiotic, there is a drug, and this drug interacts with the receptor, and after their chemical binding or interaction, there will be a chain of cascades of biochemical events that will happen after the interaction between drug and receptor. So this drug and receptor interaction will cause a chain of biochemical events or cascades of chemical reactions or pathways. Then these cascades of chemical pathways will cause a drugs observed effects. So in the more expect on your body response, we can see after this process. So here will happen in there. This should be receptors. Let's say these receptors are where the target site ናቸው ወይም ደግሞ አንድ ድራግ ሄዶ ባይንድ የሚያደርግባቸው ሶኬቶች ሊሆኑ ይችላሉ፣ ቦታዎች ሊሆኑ ይችላሉ። We will try to see the details about the receptor types and how drug interact with receptor because we do have different receptor types. ለምሳሌ mainly active site of the receptor ጋር ነው bind and drug bind ሲያደርግ. However, a drug can bind the allosteric site, the other site which is present on that specific receptor. So the importance or the vitality of this receptor is very, very, very crucial. The other terminology is pharmacodynamics. So pharmacology can be generalized in two terms. One is the term pharmacodynamics. The other one is pharmacokinetics. So these two terminologies generalizes pharmacology into two wings. So we will see them what pharmacodynamics and pharmacokinetics are. So pharmacodynamics is the action of the drug on the body. So now the drug is empowered, or the drug can exert its pharmacological effect on the body. So it tells us what the drug does to the body. And if we know, for example, if a drug is used to treat diarrhea, we can prescribe a specific drug based on this mechanism of action. Or if we know that the mechanism of action of a specific drug is to treat diarrhea, we can administer or we can prescribe that specific class of drug to specific patient. So pharmacodynamics plays a major role in deciding whether that class of drug is effective therapy for a specific disease or symptom. So this way, pharmacodynamics only tells us what the drug does to the body. So what is the action of the drug የሚለውን የሚነግረን ነው pharmacodynamics. ስለዚህ one of the terminology is pharmacodynamics. The other one is pharmacokinetics, which is the reverse terminology for pharmacodynamics. ወይም ደግሞ pharmacokinetics የpharmacodynamics ተቃራኒ እንደማለት እንችላለን። ቅድም እንዳለው we study the effect of the drug on the body, However, in pharmacokinetics, we study what the body does to the drug. ምን ማለት ነው? ስለዚህ now the power is in the hands of the body. So in the body we have different systems. So these systems have at least major 4 processes are. እነዚህ ምንድናቸው? absorption እንላቸው፣ distribution እንላቸው፣ metabolism እንለውና excretion እንለው property ወይም process አለ። So these processes determines the exerted drug action and the expected response is balanced ወይም ደግሞ the amount administered to a specific patient or to a specific target site reached exactly the same መሆኑ ቼክ ምናደርግበት። ስለዚህ if a drug involves administration and administer የተደረገው ዶዝ እና finally target site የተደረገው ቫሪ ካደረገ ያ ማለት ነው in the middle there were processes that hinder or that avoids this drug action due to different reasons. One of the reasons can be absorption. Maybe the drug absorption to the blood-brain barrier maybe poor ከሆነ ስለዚህ እንደዚህ አይነት ኬዝን ለሚፈልግ ዲዚዝ ብትሰጡ ወይም ደግሞ ለእንደዚህ አይነት ዲዚዝ ብትሰጡ absorption ፕሮፋይሉ ሎ የሆነ ብትሰጡ የሚደርሰው the amount that reached the target site ወይም ደግሞ bioavailable የሆነው amount በጣም ሎ የሆነ even though the drug is effective due to the absorption property of that specific drug ምን ይሆናል ማለት ነው? The expected drug action or response will be minimized ይሆናል ማለት ነው። So due to that the bioavailable amount or the amount that reached the target site ምን ሆነ ማለት ነው? ቀንሰው maybe ደግሞ distribution ሊሆን ይችላል። The distribution profile maybe ከፕሮቲን ባይንዲንግ ተያይዞ በጣም highly distribute የሚያደርግ ከሆነ it can reach to the desired target site and it can exert its effect. However, እንደዛ ካልሆነ ግን ባይንድ እንዳደረገ የሚቆይ ከሆነ ግን ይሄ ማለት ነው the drug will not be distributed and the case will not be treated ማለት ነው። ስለዚህ ኢፌክቱ still diminished መሆን ይችላል። The other one is metabolism. Metabolism is important for activation of those product ቅድም ያልናቸው inactive ፎርሞች ሲገቡ እነሱን አክቲቬት አድርጎ ወደ አክቲቭ ለማድረግ አንደኛ ይጠቅማል። ሁለተኛ metabolism is major important for the excretion of pharmacological agent because we have said that these agents are denobiotic when foreign substance ናቸው። ስለዚህ ሰውነታችን ውስጥ ለዘላለም አይቆዩም። there is half life እና ከዛ ደግሞ ከሰውነታችን የሚወገዱበት time ናቸው። ስለዚህ a process is possible due to the metabolism process. It can metabolize into different compounds that can be excreted through either the kidneys ሊሆን ይችላል ወይም other system ተጠቅመው excreted mainly the renal system is involved in the excretion process. So before that there should be a metabolism process that can manipulate those chemical structures. And if a drug has got extensive metabolism, the amount that reaches the target site also decreases and it will cause a problem. The other one is excretion. Excretion helps us to remove those unwanted or after getting the therapeutic effect from a drug should be excreted through the renal system or other GI in the fecal process. So this kinetic profiles ወይም ደግሞ this ADME processes absorption, distribution, metabolism and excretion process has got great significance in selection and administration of a particular drug for a particular patient. ስለዚህ urgent response የሚፈልግ ሲሆን we have to see its absorption and other profiles. ስለዚህ delayed እንዲሆን ችግር ከሌለው እሱን መምረጥ እንችላለን። Based on these 4 processes we can select which drug is appropriate for specific case management. The other terminology most of the time used is pharmacogenetics or pharmacogenetics. This pharmacogenetics or pharmacogenomics studies those genetic variation. And due to this genetic variation, which can cause differences in the pharmacodynamics and PK, which leads into a difference in drug response. ስለዚህ due to genetic makeup ወይም ደግሞ genetic variation PK/PD ላይ difference ማምጣት የሚችል variation ካለ finally it will cause a difference in drug response. ስለዚህ because እያንዳንዱ specific receptor is gene coded, right? Gene coded ነው ፕሮቲኖች ናቸው gene coded ናቸው። ስለዚህ ያ gene alteration አለ ማለት the drug response might get altered. ስለዚህ እነዚህን specific gene alteration ምን ያህል የድራግ ሪስፖንስን አፌክት ያደርጋል የሚለውን አሰስ ለማድረግ this pharmacogenetics or pharmacogenomics studies are very important. Usually this genetic variations በጣም አድቫንስ ከማድረጉ የተነሳ ፎሪን ካንትሪዎች ወይም ያደጉ ሀገራቶች ላይ developed countries ላይ gene drug interaction ራሱ አሰስ ማድረግ የሚችሉበት ስታንዳርድ ላይ ደርሰናል። እኛ ገና drug interaction, drug food interaction, drug health interaction ላይ ነው ያለነውና those individuals are seeing the gene drug interaction and its effect on the drug response. So the source of pharmaceuticals is the second topic in our introduction section. And drugs are not men አይደለም ከሰማይ ዱብ የሚል ነገር አይደለም drugs. So it will take forever or 10-15 ዓመት ሊሆን ይችላል አንድ drug ለማርኬት አውጥቶ ዲስፔንስ ለመሸጥ ማርኬት ለአቬለብል ለማድረግ it will take በጣም ረጅም ዓመት because of the different preclinical and clinical processes. So mainly as a source, these pharmaceuticals, medications or drugs are derived from natural substances, and the other one synthetic derivatives. So these natural sources can be plants. Plant extract plants generally plant medicinal, specifically medicinal activity either by traditional healers or by serendipity በድንገት የሚገኙ ሊሆኑ ይችላሉ። ከአኒማል ኤክስትራክቶች የአኒማሎች ሐሞት ሊሆን ይችላል። ስፔሲፊክ ኦርጋን ውስጥ ያለ ኢንተርናል ኦርጋን ውስጥ ያለ ሊሆን ይችላል። ሚነራሎች ሊሆኑ ይችላሉ። ማይክሮ ኦርጋኒዝሞች ሊሆኑ ይችላሉ። ከነዛ የተወሰደውን ኤክስትራክት በኢንዱስትሪ ሌቭል ዶዜጅ ፎርሙሌሽን ተዘጋጅቶለት either በታብሌት በካፕሱል or በአደር ፎርሙሌሽን ተዘጋጅቶለት ለማርኬት አቬለብል እንዲሆን ማድረግ ማለት so one of the sources the natural sources. The second one is the synthetic derivatives. These synthetic derivatives are not out of nowhere የመጡ ሳይሆን based on the natural or the available mainstream drugs ከነሱ ላይ by using combinatory chemistry ወይም ደግሞ structure activity relationship በመጠቀም saying changing or manipulating a specific halogen ሊሆን ይችላል specific structure ሊሆን ይችላል methane group ሊሆን ይችላል whatever the chemical structure manipulation በመስራት drug can be derived or the naturally existing substances in our body can be synthesized as synthetic derivatives by using their structure, mimicking their structure. So እንደዚህ በማድረግ there are synthetic opioids አሉ ብዙ አይነት synthetic የተሰሩ አሉ. So mainly a drug discovery process will take at least 10 to 15 years ይፈጃል። ግን ዝም ብሎ ቁጭ ብሎ ሳይሆን ይሄን ያህል የሚፈጀው due to the extensive ethical issues, extensive processes. So the first step will be testing that specific medicinal use on in vitro scale. In vitro ላይ ቴስት ማድረግ ያስፈልጋል። in vitro ስንል mainly living organism ላይ living system ላይ biological system ላይ ሳይሆን maybe petri dishes ላይ ወይም ላቦች ላይ ቴስት እናደርግባለን so based on the response or the result we received from this lab if positive የሆነ result ከመጣ we can go to the preclinical studies which involves laboratory animals. So these laboratory animals are animals that are only used for the sole purpose of scientific advancement. So እነዚህን animals ለምሳሌ ራቶች ሊሆኑ ይችላሉ ወይ ማይሶች ሊሆኑ ይችላሉ ወይ ኪኒፒግ ሊሆኑ ይችላሉ so እነዚህ animals ላይ using different pharmacological model we can test them the drug the investigational drug እነሱ ላይ መሞከር እንችላለን standardized የሆኑ pharmacological models ስላሉ በዛ ላይ ቴስት ካደረግን በኋላ if እነዚህን preclinical stages ካለፉ በኋላ we can go to the clinical trials which involves human ላይ የአኒማል ስታዲዎችን ያለፉ investigational drug agentዎችን clinical different phaseዎች አሉት እነሱ phaseዎች ላይ ቴስት ማድረግ እንችላለን so this the clinical trial process is extensive and በጣም advanced የሆነ strict የሆነ ፕሮቶኮሎች ያሉት ነው እሱን ማለፍ አለበት before the in vitro testing መጀመሪያ ራሱ ኤክስትራክት ለማድረግ there are different techniques እሱ ራሱ sometimes ይፈልጋል after clinical trial ራሱ successful ሆኖ ቢያልፍ and market ላይ ራሱ ቢወጣ would have another also post market surveillance ምንለው ደግሞ አለ like and drug and company የሆነ product እንትን ካለ በኋላ ዲፌክት አለበት ብሎ recall እንደሚያደርገው similarly drugs can be recalled to the industry the pharmaceutical industry so that will not cause any further damage so based on this procedure we can get pharmaceuticals or drugs from two sources one is from the natural the other is from the synthetic so ለዛሬ በዚህ ሴክሽን ላይ አቆማለሁ ግን we will continue እንደዚህ ያወራን እየተማማርን እንቀጥላለን ሐሳብ ካላችሁ ጥያቄ ካላችሁ ልሰራላችሁ የምትፈልጉትም ነገር ካላችሁ በኮሜንት ሴክሽን ላይ ልጠይቁኝ ትችላላችሁ በዚህ በሽንተን ባልናቸው 14 ስላይዶች ላይ we will have question and answer session ስለዚህ በሱ ላይ ደግሞ እንገናኝ ይሆናል እስከምንገናኝ ቻው thank you